A report by the United States Centers for Disease Control and Prevention says the number of cases involving all three common sexually transmitted diseases has increased for the first time since 2006. The 2014 Sexually Transmitted Disease Surveillance Report released recently shows that in the U.S., the number of reported cases of syphilis increased 15% over 2013. The number of gonorrhea cases rose 5% last year, and reported chlamydia cases increased by 3%. Sexually transmitted infections are spread primarily through person-to-person sexual contact. There are more than 30 different sexually transmissible bacteria, viruses, and parasites. The World Health Organization says each year worldwide, 500 million new cases of syphilis, gonorrhea, chlamydia, and trichomoniasis occur in adults. The WHO says overall STD prevalence rates continue to rise in most countries. Now joining us in the studio is William Smith, Executive Director of the National Coalition of STD Directors, NCSD. Mr. Smith, welcome to Africa 54.
Thank you. Thanks for having me.
It's great to have you. Listen, what do you make of this increase in the United States?
Sure. So I think sexually transmitted diseases are a global epidemic, but what the domestic data here in the U.S. tells me is that we're in big trouble. We have seen significant increases in all three of these diseases, as you mentioned, and these are the diseases that we track and record the number of infections. So these are really worrisome trends, and we have to have a very strong reaction.
Worrisome indeed. Do we have an idea as to why there is this increase?
I think it's a really good question. I think we know a number of things. The first is, with HIV becoming in this country much more of a chronic condition that is treatable, we're seeing people use condoms less and less, which is a huge concern to us because the best way to prevent STDs, and in particular syphilis, gonorrhea, and chlamydia, is to use a condom each and every time you have sex. So that's a big issue for us. And also there's just the notion that if there are more STDs in a community and people are not getting tested as frequently as they should, there's more disease in a community and therefore more transmission happening.
But is there a sense that there seems to be a shift from these diseases in terms of awareness, given that HIV is taking so much focus?
I think that's a totally fair assessment. So I think what we know is that for many years, and for very good reason, our primary focus has been on HIV, and we can't lose our focus on HIV and AIDS. But at the same time, we're seeing significant increases in these other STDs. And what's most important is that these other STDs have their own complications, but they also increase our risks of acquiring HIV if exposed. So it's natural biology. If you have a disease that's causing an inflammation or a sore and another bacteria or virus touches that area, it increases the likelihood that you're going to acquire it. So there's lots of reasons for us to be concerned about these three STDs in particular, in addition to HIV. And we need to have a broader focus on the whole gamut of these sexual health issues.
What about in terms of age range, generations? Are the youth more at risk or the older generation? What can you tell us about that?
Sure. So here in the U.S., these diseases profoundly disproportionately impact young people. So young people in their sexual health sort of primes where they tend to be having more sex. In particular, gonorrhea and chlamydia in particular really adversely impact young people. And not treating these diseases, many of them are asymptomatic, has long-term consequences, including, for example, infertility. So it's really important that young people are taking care of their sexual health, getting tested frequently, because even though they may not have symptoms, these diseases are not inconsequential in terms of how they think about their lives and about the families they want to have.
So what about what NCSD is focusing on in terms of addressing these issues?
Sure. So it may come as a bit of a shock, but here in the U.S., the federal government only spends about $150 million every year on STD prevention. It's shocking and it's appalling. So one of the things that we believe strongly is we need more federal, state, and local resources to support the work that we need to do. Also in this country, our public health system, like our local public health departments or our state health departments, are really on the forefront of fighting STDs. fighting STDs are not a moneymaker for health insurance companies. So this is a primary role for public health, and public health needs investments by government to support it. So that's one of the key things that we're working on. And then finally, just raising awareness. So thanks for having me on the show, which is enabling us to do that. Raising awareness and underscoring that condoms are your best protection, and if you are sexually active, get tested, and get tested frequently.
Thank you so much. It's so good to have you on the program, Mr. Smith. You're welcome anytime.
Thank you. Thanks for having me.
Great. And that was William Smith, Executive Director of the National Coalition of STD Directors.